What makes you a great surgeon? Welcome to today's episode. Here are 100 surgical principles that define a masterful and ethical general surgeon, categorized for clarity, philosophy and judgment. 1. Indication is everything. Never operate without a clear and necessary reason. 2. A chance to cut is not a mandate to cut. Always consider non-operative management first. 3. The enemy of good is better. Know when to stop. Pursuing perfection can cause harm. 4. Diagnosis before dissection. Never let the operation precede the diagnosis. 5. There are no routine operations, only routine surgeons. Approach every case with fresh eyes. 6. The best operation is the one that solves the patient's problem with the least risk. 7. If you don't know what you're doing, don't do it. Ask for help or stop. 8. Trust your gut. If something feels wrong, it probably is. Pause and reassess. 9. The patient's best interest is the only interest. Avoid ego, pride, or financial incentives. 10. Primum non nocere. First, do no harm. Preoperative preparation. 11. Know your patient, their history, anatomy, physiology, and personal goals. 12. The will to succeed is meaningless without the will to prepare. Mentally rehearse the operation. 13. Always have a plan B, C, and D. Anatomy and pathology can be unpredictable. 14. Review the imaging yourself, immediately before the operation. Don't rely on the report alone. 15. The marker is mightier than the scalpel. Always mark the correct site with the patient awake. 16. A thorough, informed consent is a conversation, not a form. Ensure the patient understands the risks, benefits, and alternatives. 17. Optimize the patient preoperatively. Nutrition, glucose control, and smoking cessation matter. 18. Know your equipment. Check that all necessary instruments and implants are available and functional. 19. Respect the golden hour in trauma, but don't rush blindly. A controlled operation is better than a frantic one. 20. Assemble your team. Brief them on the plan, potential pitfalls, and their roles. Technical execution and craft. 21. Anatomy is the supreme authority. If you don't know it, you shouldn't be there. 22. Exposure, exposure, exposure. A good operation requires a great view. 23. Gentle tissue handling is non-negotiable. Treat every tissue as if it were vital. 24. Achieve perfect hemostasis. A dry field is a clear field. 25. Economy of motion. Move with purpose and efficiency. No wasted actions. 26. The scalpel is for sharp dissection. The scissors are for cutting suture. 27. Always cut toward yourself, but never toward something you don't want to cut. 28. Never force anything. If it doesn't fit or pass easily, you are in the wrong place. 29. A good anastomosis is a satisfied anastomosis. It must be tension-free, well vascularized, and watertight. 30. The simplest solution is often the best. Avoid unnecessarily complex procedures. Decision-making in the OR. 31. When in doubt, don't cut. When still in doubt, get out, i.e., abort a laparoscopic case if visualization is poor. 32. Convert to open is not a complication. It's a sound surgical judgment. 33. The only mistake is the one you don't correct. If you make an error, acknowledge it and fix it. 34. If you can't identify a structure with 100% certainty, assume it is the most important thing you could cut. 35. The time spent obtaining control proximally and distally is never wasted. 36. Respect tissue planes. They are the highways to the pathology and the key to safe dissection. 37. The most dangerous instrument is the uncontrolled electrocautery. 38. Never use a clamp or stitch you are not prepared to leave behind. 39. Check your work before closing. Look for bleeding. Check anastomosis, and account for instruments and sponges. 40. The final look. Before the last stitch. Take one last moment to survey the field. Teamwork and leadership. 41. You set the temperature of the room. Your calmness and respect are contagious. 42. Praise publicly. Criticize privately and constructively. 43. The entire team is your eyes and ears. Encourage them to speak up about any concern. 44. Know everyone's name, from the scrub nurse to the orderly. 45. A quiet or is a focused or minimize non-essential conversation. 46. A clear, calm command is more effective than a shouted one. 47. You are the captain of the ship. The ultimate responsibility for the patient's safety rests with you. 48. Delegate tasks, but never responsibility. 49. Brief and debrief. Discuss the plan before and the key learnings after the case. 50. Thank your team. They are your essential partners. Communication and compassion. 51. Listen to the patient. They are telling you the diagnosis. 52. Sit down to deliver bad news. It shows you have time for them. 53. Explain complex concepts in simple, understandable language. 54. Your patient is a person, not a disease or appy. In room 3. 55. Communicate clearly with referring doctors and the primary care team. 56. Document thoroughly and honestly. Your operative note is a legal document and a message to future caregivers. 57. Apologize for delays, mistakes, or poor outcomes. It is a sign of strength, not weakness. 58. Be present. Put down the phone and make eye contact. 59. Advocate fiercely for your patient within the healthcare system. 60. Cure sometimes, treat often, comfort always. Post-operative care. 61. The operation is not over when you close the skin. It's over only when the patient is fully recovered. 62. See your patients yourself, every day. Don't delegate the key assessment. 63. If your gut tells you something is wrong, something is wrong. Investigate immediately. 64. Early mobilization saves lives. Get them out of bed. 65. Aggressively manage pain. It impedes recovery. 66. Be the first to recognize your own complication. Do not hide from it. 67. Have a low threshold to take a patient back to the OR if they are not progressing as expected. 68. Own your complications. Follow the patient to the very end, no matter the outcome. 69. Prevent venous thromboembolism. It is a silent killer. 70. A timely discharge is good care. An unnecessary day in the hospital is a risk. Ethics and professionalism. 71. Never let a business arrangement influence a clinical decision. 72. Maintain patient confidentiality rigorously. 73. Never speak ill of a colleague to a patient or family. 74. Your reputation is built on your integrity. Protect it fiercely. 75. Be honest about your outcomes, both good and bad, for quality improvement. 76. Competence over confidence. Know your limits. 77. Continuous certification is a moral obligation, not a bureaucratic hurdle. 78. Avoid the someone else's problem mentality. If you see an issue, address it. 79. Give credit where it is due. Acknowledge the contributions of others. 80. The patient has the right to refuse care, even if you disagree. Continuous improvement and teaching. 81. The day you stop learning is the day you should stop operating. 82. Reflect on every case. What went well? What could I have done better? 83. Read relentlessly. Stay current with the literature. 84. Seek out challenging cases and mentors who are better than you. 85. Teach enthusiastically. The future of the profession depends on it. 86. Welcome questions from students and juniors. It makes you think and improves safety. 87. Practice new techniques in a lab before trying them on a patient. 88. Emulate the best technical surgeons you have seen. 89. Audit your outcomes and compare them to national standards. 90. Embrace new technology that truly benefits the patient, not just because it is new. Personal resilience and balance. 91. Take care of yourself. You cannot pour from an empty cup. 92. Know when you are too tired, angry, or impaired to operate. 93. Find an outlet outside of medicine. Have a hobby and a life. 94. Sleep, exercise, and eat well. Your patients depend on your physical and mental sharpness. 95. Ask for help when you need it, whether for a difficult case or personal stress. 96. Build a support system of colleagues, friends, and family. 97. Learn to leave work at work. Be fully present when you are home. 98. Acknowledge the emotional toll of surgery and find healthy ways to process it. 99. Celebrate your successes, both big and small. 100. Remember your purpose: to alleviate suffering and serve your patients with skill and compassion. That's it. 100 surgical principles that makes a great surgeon. Thanks for tuning in. If you enjoy the content, please like, share and subscribe. It's the Everything Surgery Podcast. Dissect the extraordinary.